Good morning and welcome to today's Return to Campus Town Hall webinar. My name is Dr. Brian Hamluck and I serve as the Associate Dean of Students and Director of Administration here at the University of Pittsburgh. Today, I am pleased to facilitate a session with key leaders on campus and in the medical field covering the important service areas of housing and move-in, dining services, academic affairs, new student programs and welcome week, campus recreation, student health services, and COVID-19 topics, including testing. We will start with each panelist giving a brief overview of the key current topics from their areas, and then we will have time to take some questions at the end. If you have questions, please utilize the Q&A function at the bottom of your screen. For the purpose of this session, please try to keep your questions broad in nature so that all participants can benefit. If you do have an individualized, specific, or nuanced question, we will be providing contact information for all of our key areas at the end of the session. With that housekeeping information taken care of, let's get started with our first panelist to provide some information about housing and move-in. Here is Kathleen Kyle, our Director of Housing and Panther Central.
Good morning, everybody. I hope that you're doing well on this Thursday. I wanted to start off by saying that we've had our first 2 days of arrival the last couple of days, and everything has gone very smoothly. We've been very encouraged by the way that our Pitt community, students, parents, staff have been very respectful of the health and safety guidelines that we've set forth, very respectful of the schedule that we put forth. We know that it was very specific. And just been grateful that folks have been patient, but have come. We've been able to get people moved in, troubleshoot any small issues we've had, and seems like we've gotten a lot of good feedback. And so if you've not moved in yet, hoping that you will also experience similar smooth sailing once we get ourselves up and running. So a couple of things about move-in. I'll start there. As y'all are aware, we are spreading out our arrival process over a longer period of time. And really what that was able to do, and we saw yesterday, was really cut down on the amount of traffic, both car parking traffic, as well as elevator traffic, all of those types of things, right? There were far less lines, not needing to queue as many folks at a time. And so we were very happy with how that went yesterday. So just know that also connected with that is our Ship to Pitt program. Hopefully you've taken advantage of that. It's gone well. We had over 14,000 labels printed and packages shipped to us. And so our mailing services team has been busy getting all of those delivered to rooms. Again, we had very good experience with that process over the last couple of days. Just a couple of dates that I wanted to remind folks of. I know that folks were a lot of questions kind of coming in about how is this semester going to end. And so I wanted to at least address that issue. So our semester is going to end on the 25th for all in-person classes. So we are asking students that are able to and willing to go ahead and depart campus on the 25th. That's our first initial end and first initial close of our residence halls. If you do leave for Thanksgiving break, we ask that you stay home or away from campus as to prevent any health and safety concerns there. If a student does need to stay between the 25th and December 6th for travel reasons, different types of final schedules. I just know some of our nursing programs and whatnot are nuanced. We will accommodate anyone who needs to stay through the 6th. And then on the 6th, we will close permanently for winter break and not reopen our residence halls until January term begins. I know folks have asked questions, can I leave things? Yes, you can leave things in between this break. Just make sure that you take anything you might need and don't leave any perishables behind. Let's talk a little bit about health and safety. Just wanting you guys to know that the housing, maintenance, housekeeping end of things have taken a lot of precautions. We've doubled all of our cleaning in our common areas from once a day to twice a day. That includes common bathrooms, lobby areas, elevators, all of those things. We have new protocols in place for cleaning all those high touch surfaces. Air quality has been something that we've looked at in all of our buildings and making sure that our air quality systems are at the maximum procedural places there, that we're getting as much fresh air into the buildings through our HVAC systems as possible. All of our amenities, so lounges, community kitchens, fitness centers, and the residence halls are going to begin the year closed. And as we are able to assess state health and safety and our posture for the university, we will hopefully be able to open those up in the coming weeks or months. Again, when you come on campus, you will see signage everywhere, lots of signage, everything from reminding folks to not to put your toothbrush down on the sink, to where to stand when you're queuing for an elevator. So all of that is labeled for folks. All of our elevators are different sizes, so therefore capacities are different. Please pay attention to those posted signs and follow them to the best of your ability. Like I said, things went very, very smoothly the last couple of days when it came to physical distancing and cleanliness and all of that. I will just say one more thing about cleanliness, and that all of our students who live in suite style or apartment style capacities where they have a bathroom internal to their bedroom, we have created a new program called Pit Shines. And so every student is going to be receiving a bucket with some cleaning supplies in there, a mop, and then also instructions on how to attain more of those if you need them. And we're just asking that you all help us with our health and safety cleanliness standards. So I'll pause there. I know that everyone has announcements for you all, and then we look forward to answering any questions. Thank you.
Great, thanks so much, Kathleen. Now I'd like to turn it over to Joe Beeman, Director of Dining Services.
Hi, everybody. Welcome to Pitt. We're really excited to have you. And, as Kathleen had mentioned, we were really excited for the opening and for the first couple of days of arrival. And in dining, they have gone really well. So as was briefly mentioned before, the university has printed over 15,000 signs, floor signs, decals, wayfinding to help make it easier to communicate and make sure that we are all on the same page with our accountability measures and our responsibility. So as pertains to dining, I just want to kind of go over, the first couple of weeks and what the student should expect. So as Kathleen had mentioned, our risk postures are really how we're looking at accessibility issues and, how we're going to administer our program. So up through September 4th, all of the meals for Pitt Dining, for Pitt Eats, are going to be to go. So all of our meals are being, packaged up. Students will still be able to come into the residential dining locations, choose what they would like to have that meal to go. If they want a couple of different options, that's fine. They can have a couple of different boxes. Bring that back to a physically safe distance to eat in their dormitories, or outside if space and weather allows. So really excited for that. Wanted to talk about a couple of new things with our Pitt Eats program. So not only do we have the two dining halls that have been in our program, and the eatery at Market Central and Towers, and the Perch up at Sutherland, we've also created two new dining locations. One of them is an outdoor covered dining location that we are calling the Hub at Posvar Patio. It's centrally located on campus. And what this is an outdoor space, a very large covered outdoor space that's going to allow students to utilize their meal plans, both their meal exchange and their all you care to eat meal plans outside in a physically safe distance mentality. So that's going to open up next week. We're really excited. It's a brand new way of creating some extra opportunity while maintaining the physical distancing requirements that we need. With the new meal plans that we have this year, every one of our residential meal plans has one meal exchange. So what a meal exchange is your student will get to go to any one of our retail dining operations on campus and use one of their meals as a retail meal deal, as we're calling them. So you could go to Chick-fil-A every day if you wanted, or Taco Bell. Yesterday, we opened the brand new True Burger concept where your student can go and utilize their meal swipe there, take that meal to go. So this does a couple of things. First, it's fun for the students. We know that students like to go to these retail operations. It might be Pizza Hut, might be Einstein Bagels. It's some of the more frequent in places on campus, but it's also allowing for physical distancing measures. By doing that, we're de-densifying our dining facilities to really allow for students to maintain a safe and yet delicious fresh made meal. students are going to notice that all of our areas have plexiglass that's been installed for protection of both them and our team members. That is throughout campus. We have installed those at all of our locations in order for our students to have that experience and feel safe. They're also going to see floor decals of wayfinding, of where to go. We have entrance only doors and exit only doors. When you're on campus, you're going to see that these are clearly marked and that the communication protocol are in place. So one of the other things that we're doing, and we think we're the only one of the only universities in the nation doing this. We're allowing for students to use 25% of their dining dollars within their meal plans at select locations throughout Pittsburgh, throughout the Oakland community. This is for a couple of reasons. One, we really wanted to partner with some of our small businesses in Oakland as they count on the university and we count on them for the culture that is Oakland. So we're really excited about that. You can go to our website, which is dineoncampus.com/pit, and you can go and find out all of the locations that these dining dollars will be taken. If you go to the website and you go to the more information, it's going to have off-campus vendors. So that's a good place to see where these dollars can be used. But I would also, while you're under the more information, pull up the Welcome Week. Because what Welcome Week is for us is through September 4th, it shows all of the locations with a map of where we recommend students to go. So if you live in Lothrop Hall, we have a recommendation that you go to the hub at Posvar. If you are in Irvis, we recommend that you go up to the Perch. The reason that we're making these recommendations is because we've done all of the customer counts and all of the flow charts, and this is the best way to maintain a safe physical distancing mentality. So we're really excited about that. We have a lot of new programming going on. So many of these are based around COVID, right? But we also want to talk about the experience part of campus that makes Pitt. We're super excited about that. We've got a brand new coffee program called Tradecraft coming, where we have partnered with 4 local roasteries throughout the Pittsburgh region, and we are going to be known as Coffee U, the #1 coffee campus in the United States. It just went live this week, so I get really excited about this. I work with Kathleen all the time. She'll tell you I've been talking about this nonstop. So we want you to have fun. We want you to enjoy your dining experience. We also, our first priority is to keep your students safe, to keep our staff and faculty safe, and to make sure that we're following all the protocol that were set in place for your protection. Thank you, Brian.
Thanks so much, Joe. Now to talk about some of our academic approaches for the fall semester is Stephanie Hugendorn, our Director of Academic Affairs.
Thank you so much, Brian, and good morning, everyone. It's really a pleasure to welcome everyone back to Pitt. It's great to see some of our students on campus. I've had a chance to say hello to some of them, and it's just great to be able to move forward. So I just want to address some of the most common questions that our academic team has been getting of late. The first question that we continue to hear, and I know that there's a lot of confusion about, is how exactly classes are going to be offered. So at the Pittsburgh and the Greensburg campuses, these campuses are both in elevated risk. So this means that the vast majority of classes at Pittsburgh and Greensburg are going to begin remotely. So almost all of your classes are going to be online until the risk level changes at these campuses. Of course, at our other campuses, Bradford, Johnstown, and Titusville, these are in the guarded risk. So these classes will be offered according to the Pitt at Flex schedule. So you can now check in PeopleSoft, definitely at the Pittsburgh campuses, and I'm sure we're finalizing our other campuses as well, to find your classroom assignments and to find the final meeting times for your classes. I know at the Pittsburgh campus that we have added some passing periods, and we might have changed the beginning time or the end time just to allow a little more time, so that when those classes are happening in person, that there'll be more time to leave and get to your next class safely with some of the protocols in place. You can see now that the courses that are going to meet remotely only are going to be denoted in the catalog as a web-based class. That's a web-based class. And then for the Pittsburgh campus, we're just finalizing when the campus moves into a guarded risk operational posture, there will be annotations added into PeopleSoft that will tell you how your classrooms are going to meet. Is it going to be that the full cohort is going to meet in class? Is it going to be a rotated system where if it's a Tuesday, Thursday class, maybe half of the class comes to class on Tuesday and then the other half comes in on Thursday to give that in-person opportunity? Or is the class still going to be all remote because it's large? So again, those should be added shortly for the Pittsburgh campus into PeopleSoft. Another question we're getting about the PIDIT-Flex model is because it gives students the opportunity to either attend classes remotely or to attend classes in person when we're in the right posture. Do you have to tell your professor or your instructor about this? And the answer is no. This model is meant to be flexible. It's meant to give you choices. So you don't have to tell them on a day-to-day basis how you're going to attend that class. Another question that we've been getting is about the bookstore and about syllabuses and how you might collect your books. I believe that that instructors are still working on finalizing their syllabi, and those will be sent to you when classes start at the beginning of class. Instructors know that it may take you a little longer to get your books than normal, so there will be some flexibility in when you get your books and in those courses that are started. The bookstore currently has details about how to order books online and get those sent to you if you are in the US. And my understanding is that they're working on if you're international, they're working on finalizing the details about how you would get your books in those situations. And then the last comment that I wanted to make is the academic team and the academic innovation team has been really hard at work on putting together resources for you. We're still working on this, but we're close to being able to share with you updated ways that you'll be able to get some of the academic support remotely once class starts, and we hope to have this information available for you soon. And additionally, once everything with the courses and the rooms are completed, then one of our next goals is to try to designate various study spaces that you'll be able to go to and study on campus. So please, please continue to be patient. Classes don't start for another week, and we will be continuing to update this information and provide more information to you. So thanks so much, and welcome back to campus.
Stephanie, thank you for all that information. Now to talk about our Welcome Week and our new student programs is Brianne Donahue, Interim Director of New Student Programs. Brianne?
Hi, everybody. Thanks, Brian. So just a quick information about Welcome Week. Welcome Week is virtual, so no matter where students are, they can participate safely. So whether that is you're in the residence hall and sheltering in place, in the car on the way to campus, or at home, our events will be a mix of synchronous and asynchronous, live and pre-recorded events. We have over 55 virtual events offered. They're a mix of social events, so students can virtually meet friends, find common likes, and start to build that community, as well as informational events of the information students need as they start their semester at Pitt. So to see the Welcome Week schedule of events, two ways you can see this. A mobile friendly website, short site is pi.tt/WW20. Or you can simply go on the university events calendar and search Welcome Week. And then also on the Student Affairs Welcome Week website, you can find a printable PDF schedule as well as a listing of events. So please check those out. They started yesterday. We had some social events last night, and our events will go throughout most of this arrival process. They started yesterday, and events will go all the way up to August 23rd. So more than a welcome week. We have a welcome period where we'll have events for students to engage in online. Keep an eye out for 6 required programs. They're going to start on Sunday, August 16th, and they'll be just on the 3 days, Sunday, Monday, and Tuesday, August 16th, 17th, and 18th. So those required events there's one on Sunday evening, our health and safety at Pitt. We're going to start with talking about health and safety guidelines, going over some of this that students may know but need to be reminded about, as well as how we can keep our community safe and our expectations and what we really need to do for each other in this community. So we're going to start there on Sunday night. That's at 8 p.m. Eastern Standard Time. And then on Monday, there are 2 events. The first is Building a Pitt Community. That's our diversity, equity, and inclusion event, followed by our residence hall building wide and floor meetings for our on-campus and hotel students only. That's Monday afternoon at 2 p.m. Eastern Standard Time. If you're a transfer student or the parent of a transfer student or a commuter student, we will also have programming during that time to address needs of students and engage students with each other during that time. On Tuesday, there are the 3 remaining required events. Tuesday morning at 10 a.m. Eastern Standard Time is the academic meetings. So students will touch base with the Academic Advising Center of the school to which they were admitted to get any last minute type of enrollment and advising questions and tips. And then in the afternoon, the tipping point, which will cover public safety, sexual assault, harassment, and assault and harassment prevention and awareness, as well as substance awareness. Again, that's Tuesday afternoon at 2 p.m. And then we will kind of finish up with our new student welcome. So this is where the Chancellor, Patrick Gallagher, our Provost, and CUD, our Dean of Students, Kenyon Bonner, as well as a lot of other senior administrators will welcome our new students to the fall term, as well as their family members. And then we will follow by a fun event, Why We Hail to Pitt, and talk a lot about our Pitt traditions and kind of wrap it up there. Family members are welcome to tune into the Welcome Week required events as well. And we really encourage students to watch these events with their roommates or suite mates or their pod. Some of these events will really talk about community and building relationships, and what better people to watch them with the people that are close to you in your room or in your suite. So we encourage students to watch these together, since we can't all be together in the masses of the thousands. Encourage your student, if you're a family member, to do that. All required events will be recorded and posted to our website. So if there is an event that you just cannot make, keep in mind that we will post those recorded required events to our website. So if you have any questions, we'll be sharing information at the end. Thank you so much.
Great, thank you, Brianne. One of the many things that we're proud of here at Pittsburgh, University of Pittsburgh, is our comprehensive approach that we take to wellness and the wellness of our student body. So our next few presenters are going to talk about various aspects of that. And I'm going to turn it over to Jill Krantz, our Executive Director of Campus Recreation.
Jill, you're muted.
There we go. Sorry about that. Thanks, Brian, and hello, everybody. I had a chance to be on campus this week already a couple of times, and it's so exciting to see the students back and returning and all the energy that they have. So I know, like everybody else here, I'm really excited to see the students here and ready to go. As Brian said, I'm going to share a little bit about campus recreation and how we're here to support everyone's fitness and wellness, and then also keeping that in mind from a health and safety standpoint with the COVID situation. As most of you know, our facilities are highly utilized by students, faculty, and staff. And so this morning, I thought I'd just hit some of the highlights and some of the questions that we're receiving at this point in time. First, all of our facilities will be open following the shelter-in-place period. We will be working a little bit on modified schedules, and similarly, we'll have in-person programs and also virtual program. So many of those details are just being finalized, and they'll be posted on our website, and we'll be pushing those out through our social media resources as well. Some of the really significant changes that students will see this semester on campus is the first thing is we'll have an online reservation system so that students can use our facilities, know they can get in there during a certain time. As our facilities are pretty high demand, we just thought it would be really helpful to have a system where students knew that when they picked a time, they could come in and amongst the rest of the many busy things they're doing during the week, they know they've got a slot where they can work out or go play basketball or something on that order. So we're excited to see that, but we do know that will be a big difference for students compared to how they usually operate. The other thing is, like everywhere else on campus, students will be wearing face coverings in our facilities and our outdoor spaces when they're participating in activities. Like the other panelists have mentioned, you'll see plexiglass in our spaces so that check-in desks can have physical distancing as we work with students. And then with all of our fitness centers, we have a wide variety of cardio and strength equipment and pretty much you name it. And we tend to be pretty closely packed. And so one of the things we've done over the last several weeks is to take time to spread our equipment out so that we're able to have a little bit of extra distance between them. And then we're going to also ask in many cases when students are working out in those spaces that they'll have to physical distance from piece to piece. So for instance, if they're using a treadmill, they may need to take 1 or 2 spaces vacant and then use the treadmill next to somebody down the row a little bit. So those are kind of the things that will be majorly different. From the standpoint of our locker rooms, they'll also be open, but we do encourage people to come dressed and ready to work out so that they can limit their space in those, limit their time in those spaces. From a programming standpoint, we're going to be offering our typical slate, but again, they will look a little different so that we can support physical distancing and minimize our personal contact. So for intramurals, we'll have kickball, dodgeball, volleyball, and then also esports. Our club sports will be also offered, but they will be obviously operating on a little bit different status than they normally do. We'll ask them to really work closely with us on following the university guidelines for social distancing, travel, and those sorts of things. And then of course, most of them will also be working with their national governing bodies related to practices and competitions. We'll also be offering in-person and virtual group exercise classes, and this year they'll be free during the first semester. So we're real excited to have that opportunity for students to either be in person or virtual when they're participating in these programs. Lastly, we'll, from a cleaning standpoint, really be stepping things up differently during the day. Our students who work in our facilities, as well as our full-time staff, will be helping clean the high-touch spaces. Again, much like you've heard from other folks, we're going to be doing some extra work in that area. And then overnight, our spaces will be deep cleaned to ensure that when folks kick it off the next day, they're able to have a space that's safe and clean. And then the last thing in regards to cleaning and disinfecting and that sort of thing, we're really asking students to be part of helping us keep our spaces clean. We'll ask that students wipe down equipment before and after they use it. And again, that will help everyone know that things are clean and safe for the next person. While we know a lot of these things are different this semester, a lot of them will really be the same. Our student staff, as well as our full-time staff, are here to help everybody be fit and well. As Brian mentioned, we're really excited and pleased to be part of that on campus. And then lastly, we just would really encourage your students to be outside as much as you can. We have a great fall weather typically, and we would just love to see people outside and enjoying the space to be healthy and fit as well. So, thanks, Brian.
Great. Thank you so much, Jill. Now to talk to our approach to student health and the services that we offer there, I'd like to introduce Marion Vanek, our Executive Director of the Wellness Center and Director of Student Health Services. Marion?
All righty. Good morning. As the Executive Director of the Wellness Center, I'm very pleased to provide you with some information about our services and some of the recent changes that we just recently made here at the Wellness Center to best serve your needs during these challenging times. The Wellness Center is an integrated health service that consists of an outpatient medical clinic, a very busy counseling center, a full-service pharmacy, and a very active health education program. We maintain a patient-centered philosophy, and we have a very strong commitment to quality. We're staffed by board-certified physicians, psychiatrists, nurses, nurse practitioners, medical assistants, psychologists, counselors, social workers, pharmacists. We even have a registered dietitian on staff. We're accredited by the American Association of Ambulatory Healthcare on the medical side, and the Counseling Center is accredited by the International Accreditation of Counseling Services. And just to give you some perspective, less than 35% of student health services in the country actually are able to achieve this accreditation. Since the pandemic, and to ensure the health and safety not only of our students, but also our staff, we had to implement some new and safer ways to provide healthcare. This included the introduction of telemedicine, teletherapy, online programming for all of our stress reduction, as well as other health education programs. And we even provide curbside delivery and mail delivery of all of our prescriptions and pharmaceuticals, if you wish. We still do provide on-site medical care when appropriate. So for services and needs such as immunotherapy, various medical procedures, immunizations, extensive gynecological care, and specimen collection, including testing for COVID, we provide all those services and more on site. However, one major change that we made this year is to ensure the health and safety of our staff, as well as our students. All appointments must be scheduled. We no longer will offer unscheduled walk-in appointments. And when you do call the student health service, and we'll provide this information at the end, a nurse will assist you with scheduling an in-person or telemedicine visit, and that's based on your special need. Also, for your convenience as well as safety, we provide all forms, consent forms, medical histories, and other educational materials all online. You can complete these forms via our secure portal. I think we can all agree that this is certainly a very challenging and concerning time. However, I strongly believe that if we support one another, we can certainly reduce the risk of spread of COVID on our campus. We have an obligation not only to protect ourselves, but also one another. And we can do this by knowing the facts and practicing safe mitigation measures. Many of these have already been mentioned in this presentation. One thing that we do know is that risk reducing behaviors really do make a difference. So let's talk about a few of these things. One, knowledge is powerful. Know how the virus spreads. Know the facts about the virus. We do know that it's a respiratory virus and it spreads via respiratory droplets from an infected person, someone with symptoms or someone who is asymptomatic. And as a result, we really encourage you to wear a mask when you're on campus, when you interact with one another. This really will prevent the spread of respiratory droplets, and even, or at least it significantly reduces the spread of respiratory droplets. And there also is some evidence that it can protect the wearer as well. Once you arrive on campus, you will be given 2 pit-themed masks. Do wear them. Another very important piece of information that and practice that you should include is in your daily life is avoid contact with others. Try and keep at least 6 feet of distance from one another. And you'll see the multiple signage and designations throughout campus. Wash your hands often. Personal hygiene really does make a difference. You will also notice when you arrive on campus that there are multiple hand sanitizing stations positioned throughout. Do use them. And one probably most important piece of information I want to share with you, and this is where student health can certainly assist, is know your body, know your health, take charge of your health, monitor your health daily, know the symptoms and be alert. Watch for a fever, cough, shortness of breath, any body aches, headache, or definitely a change in sense of smell. Do give us a call. Student health is there to assist you. But before you make any action, do call us first, stay in your room, and then give us a call and we will provide some assistance for you. And also, if you have any other additional questions, whether it be about your own personal health, you want to schedule a particular appointment, need to transfer some medical records to us, please don't hesitate to reach out to me or anybody else within the Student Health Service. We're here to help you. And we wish you a very healthy semester this year. Go ahead, Brian.
Great. Thanks so much, Marion. And our last panelist this morning to talk a little bit more about COVID-19 and our testing approach is Dr. Elise Martin, our Associate Medical Director of Infection Prevention and Hospital Epidemiology at the University of Pittsburgh Medical Center. Dr. Martin?
Hi, thank you guys so much for having me. So I'm a member of our COVID-19 Medical Response Office, and we've been partnering with everyone throughout campus to really find ways to make this as safe as possible for everyone's return. One of the things that we're going to be doing and have actually already started is our efforts to identify how common is COVID-19 amongst people who are returning to our campus. So we've started a surveillance program to actually assess how often are students actually positive. So some of you may have actually received emails providing you information on this, and some of you may have actually had emails identifying that you need to come in and get scheduled for testing or have been assigned a testing time. And then our testing actually began yesterday, so some have actually already gone through our testing process. We just want to say for those especially who have already come through our testing process, our team was overwhelmingly impressed with how professional you all were. We had fantastic attendance. You guys all went through and got your testing done in a safe and really effective manner. So I really, from all of our team, want to say thank you for that. And thank you for that commitment to our university. There have been some questions about the testing facility. Is this going to be a safe thing for us to do? Should we have any potential concerns for testing? And we've really gone out of our way to try to find ways to make this as safe as possible. The first thing is we are not having students come get tested who are having symptoms of COVID-19. So the risk that you might encounter someone who is symptomatic with COVID-19 is unlikely because those people we're actually recommending or following up with student health, not coming for our surveillance testing. This is also a really well-controlled environment. We have ways to prevent crowds. And yesterday we actually didn't really have much of lines or crowds at all. We've also decided to do this outdoors to help decrease the risk further. And the way that we're administering the swab, it's actually a self-swab. So you're not going to be having close contact with another person. Now the self-swab may sound a little bit scary to some, especially if you've seen news where people have shown people getting swabbed and it can look scary or painful. The way we're doing this is actually a nasal swab where you will self-administer the swab into your nose. And it's actually not nasopharyngeal, so it's not this very deep swab that you've probably seen in imaging. And we have sent out, especially to those who are going to be getting tested, a video so you can see what to expect before you come in. Going forward, some of you may have questions about your testing time or maybe needing to reschedule. Please reach out to our office. You can contact us at cmro@pitt.edu to answer any questions specifically about your testing, because we want to get those things addressed in real time. And then for those of you who are not planning to return to campus, because I know we have, especially with Flex at Pitt, some students who are going to remain at home, either out of state or international. Obviously, you wouldn't be able to come in for testing, so just let us know so we can make sure we get appropriate people scheduled for testing. And if you have any specific concerns, we want to address those in real time. So please reach out to us so we can help you with any of the concerns about either testing or COVID-19 or preparedness at the university.
Great. Thank you so much, Dr. Martin. So we have some time to take some questions. And so these will be in no particular order. But the first one I'm going to pitch over to Brianne. We have some inquiries about how students will know which sessions are required, how do they get informed of that, et cetera, et cetera.
Thank you. So I saw in the chat about guided also to those programs. So just to reiterate, all of the required Welcome Week programs are virtual. So to find those virtual programs, again, the quickest way and probably the most useful is pi.tt/WW20. On that University Events Calendar website, which is mobile friendly, you will find the links to those events, as well as the times and the dates of the events. There's also indication of the events that are required, but another great website that I encourage you to visit is the Student Affairs Welcome Week website. And on that website, there's actually a listing, there's a tab that just lists the required events, as well as the descriptions of those events. You'll also be able to see a PDF of the Welcome Week schedule that'll highlight in different colors the required events. Again, if you just simply Google, it's kind of a longer URL, but if you Google Student Affairs Welcome Week Pitt, you'll be able to get right to that, that calendar. We can also provide that link possibly in the chat as well. So again, the students will be able to find the login links and information on that university events calendar, as well as the dates and times and the indication of what is required.
Great. Thanks so much, Brianne. Joe, a question for you. This is a consistent one for our sessions. If you could talk about our approach to students with allergies, what they should do, and how we're going to handle those situations.
Yeah, Brian, thank you. So we do have stations that are dedicated to our allergy-friendly dining program. Flourish is the name of our program. It's actually free of all 8 of the major allergens and gluten. And so that is one of the options that's available at the eatery to use all of the time. I would always recommend any student with allergies reach out to our registered dietitian, Kristen Grover, and her information, as well as all of the chef information, is in that dineoncampus.com/PIT website. So I would definitely recommend going there. What'll happen is, reach out to Kristen. She'll reach back out to you. We can go as far as personalized meals if necessary. Otherwise, she can help guide you to the areas in where allergy-friendly dining, depending upon your allergy needs, are met.
Great. Thanks so much, Joe. Stephanie, we have a couple academic affairs questions. So I'm going to pitch a couple to you. Can you clarify right now when classes start? Is it still August 19th with the first 3 days as virtual?
Yes, that is correct. At all campuses, the first 3 days beginning August 19th will be virtual.
Excellent. Thank you. And will professors be holding virtual office hours?
So I think it's best to ask your instructors how they're going to hold their office hours. They also have some flexibility in the Flex at Pitt model. I would assume that the majority of the office hours will be held virtually, so you can ask them on the first day of class.
Great. And the last one for now for academics, how will students connect to their web-based classes?
Yes, that's another great question. So your instructors will provide you instructions on how to connect to their classes. Canvas is our platform for all of our courses now. You may connect and you may get into some of the classes a little bit differently. You can log into Canvas by accessing Canvas through the Pitt portal, and then you can reach out to them and email if you have any questions about getting onto your classes.
Great, thanks so much, Stephanie. Kathleen, a general question about move-in day. Just generally, what will it look like for parents? How will that check-in process go? Can you talk a little bit about the wristband and time frame that the student will have with the person that they identify?
Sure. And again, we saw this live yesterday, so it's not just conceptual anymore. But whatever parking information you received, you're going to go to your unloading zone first. They will acknowledge that you're there at the correct time, give you any instructions about unloading, parking. When you get to the entrance of the building or near the entrance of the building, there'll be a check-in station where the student, if they don't yet have their ID, they can pick it up. If their ID is waiting for them here, we will have it. They may need to, depending on what residence hall they're in, they may need to tap their ID to activate it for a couple of our systems that just got updated over the summer, depending on when we mailed out your ID. So that'll happen. And then one guest, one helper is going to be able to receive a wristband to help the student move in all of their items. We will have carts available that will help you with that unloading process. And then we will show you how to best enter the residence hall safely. We are asking that there is one helper for every student. We do also ask that you're in that unloading area for an hour. And then some of our places do request long-term parking elsewhere, right? So after you get everything unloaded, they would then direct you to where a long-term parking would be if you wanted to come back, help make the bed, right? Go get something to eat, all of that good stuff. Take some photos by the outdoor panther. You can do all those things on campus. And then your car would be in that long-term zone. Does that answer the question, Brian?
That's a good overview. Thank you, Kathleen.
Yep.
I'm going to pitch this one to Dr. Martin, based on your work with the task force, if you're able to answer this. What criteria will determine a change in risk status for the university?
So there's actually a number of things that we're going to be tracking this semester, and it's going to be a combination of what our team recommends, what the healthcare advisory group recommends, and then of course what senior leadership recommends. What we're going to be looking at is not just what percent of our students have COVID, or what is that sort of positivity rate, which I think is what people a lot of times think about when you track this information. But we're going to be looking at other things like what's happening in our area, what's happening in our county, what's happening in our local hospitals. Are we having surges of cases? Does that pose a risk to our students? Does that pose a risk to our faculty and staff? We're also going to be looking at compliance. So beyond what happens on our campus with positivity and concerns, are we having more events that are potentially increasing our risk for having more events? And so all of those factors are really going to be combined before we would have any decisions about whether or not we would change our risk posture to either elevated or go down to more of a guarded posture here on the Oakland campus. But we've got a lot of people thinking about this information, and we will definitely be sharing it as we go.
That's great. Thank you. And a follow-up question for your area again, Dr. Martin. If a student does get selected to have a COVID test, how long will it take to get the results?
We're working to get the results as quickly as possible. Most of these are probably going to come within 48 to 72 hours. Some of our days we have more testing done. So on the days with more testing, it may take slightly longer. But we're going to be really prioritizing getting the information back to you as quickly as possible. And you should be receiving results. If you have not, and you don't feel like it's been in a timely fashion, please reach out to our office to make sure that we do have the right contact information for you to get your results quickly.
Great, thank you. Another question for Joe. It says, the person is asking, can you explain one more time how to use your meal plan to take advantage of the meal exchange?
Yeah, absolutely. It's brand new this year, so we're really excited to talk about that. Yeah, so all of the meal plans and the first year and all of the non-first year meal plans will have the exchanges already once daily on your account. So your student can go and you can actually go onto the dineoncampus.com/pit. I know I keep saying that, but it is a good resource, right? It's good to just keep giving that resource there. And you can go to find out exactly what your options are for the meal exchange. So each of the locations on campus have 2 to 4 meals that are included as part of that meal exchange. It's already on your card. It's a once per day. You can do it. So we recommend, that your student take advantage of that as frequently as possible. And you can just go and have each location has a meal exchange menu right there. You can say, oh, I'll take the, Chick-fil-A was a big one yesterday. So I'll take the 8-piece nugget meal for my meal exchange. And then you go ahead and just tap your card, and that's how that's activated.
Great, thanks so much, Joe. Another question for Dr. Martin. How will students be notified if they are supposed to get tested?
So for those of you on the Oakland campus, you've likely already received your emails specifically reporting that you will be tested here on the Oakland campus. For anyone on the line for regional campuses, those emails will go out shortly. So please be checking your emails, because that's where we're going to be sending a lot of the information about your COVID testing, as well as information on how to stay safe while on campus.
Great, thank you. A campus recreation question for Jill. One inquiry is talking about last year students playing pickup events on the outdoor fields, et cetera. A, will they be able to do that? B, will masks be required for that?
Yeah, I was just reading that question and answering it. In regards to the outdoor spaces, when they're doing any activities where they're going to be within 6 feet of one another, they really do need to wear the face mask. Again, it just is going to mitigate any health issues, and the close contact would really be helpful with those face masks on. In regards to the basketball courts in particular, what I'll do is I'll share my email with this person because I'm not sure which courts, of course, the person played at, but I'll email and you can then let me know and I'll find out for sure. But in regards to the other spaces up at the sports dome, those turf fields will all be open for people to be outside and trying to enjoy the outdoors as best they can and participate in activities that are drop-in. And then, of course, we'll also have intramural and club sports going on. The only other thing I might say is if we wanted to ask Marian or to maybe share any other insights about outdoors and when they should be wearing masks, that might be helpful.
Sure. We strongly recommend that you wear a mask whenever you are out. When you leave your apartment building or your dormitory room, it's very important to bring your mask along with you.
Great, thanks, Marion. And thank you, Jill. A question for Stephanie. With the 3 different postures that we have and phases that we have for the universities, when will classes be able to be held in person and when will they not, according to those postures?
That's a great question. So when classes can meet in person, when we are in the, I believe it's the guarded rate, but I just want to triple check my my notes. I'm sorry. Yeah, so in the guarded posture, classes can meet in person, but otherwise classes need to be remote. It's possible in the guarded phase that classes that are too very large classes may only be meeting remotely in all phases.
Great, thank you.
Not clear?
Yeah,
okay.
That's helpful, thank you. A question for Kathleen. There's been a couple inquiries specific to specific rooms that students have, and they're asking about what's contained in the room. So can you give out the information of where they can go online to find information about the specific residence hall that they have?
Sure. If you go on pc.pitt.edu and go to the housing assignments portion, there is what we call kind of a one-page information guide to each of our properties, right? All of the hotels have had one created, all of our residence halls, our apartments are all on there. And that'll give you an overview. Sometimes it includes dimensions of rooms. It'll let you know what furniture is included there. And so that should answer your questions, hopefully as best we can.
Great, thank you very much. Marion, a question for student health regarding, and you can field this from a general standpoint, but question about forms, should they have a healthcare proxy, the HIPAA forms, all of those types of things. Can you just give a quick overview of what you suggest, and if the parents and students choose to do it, how they can get that information to you?
Certainly, absolutely. If there are any additional information you would like to share with the Student Health Service, whether it be power of attorney, any particular medical records that you would like to transfer to us, especially if your son or daughter has a chronic condition, or just some general information, perhaps a health history form that we do encourage students to provide to us, as well as the immunization records that you are required to share with us, and please do address that issue if you haven't already. But you can send information to us a couple different ways. You can certainly mail it to us the old-fashioned way. You can fax it to us, and our fax number is 412-383-1846. You can also email it to us, and you'll have that information on our website. Please don't hesitate to get that information to us, and we will populate our medical record with the data that you provide. And if you have any particular questions regarding confidentiality, please be rest assured that all the information that we have on you, all of your medical data, the conversations you have with your physician, everything is very confidential. We do not share any information with anyone other than you. And if you wish us to have a conversation with a parent, you will have to sign a authorization form to allow us to have that conversation. So please be rest assured that all information in the Wellness Center is always confidential and strictly maintained.
Great, thanks so much, Marion. Another question about testing for Dr. Martin. Are we expecting to test all students on campus at some point in time over the first semester?
Most likely. I mean, at this point, what we're planning on doing is regular surveillance testing. This first wave, as everyone's moving onto campus, including our off-campus housing, we're testing about 10% of our students. And this is a random selection of students who are either living on campus as well as off campus. And it will include students that are coming from local to the Pittsburgh area, throughout the state, throughout other states, including states that may be considered higher risk. And then also from international students as well, to try to get a good mix of our population. Going forward throughout the semester, we're going to be testing, doing ongoing surveillance testing as long as COVID-19 continues to be a concern, which we anticipate it will. So very likely we will all have all of our students get tested at some point if the pandemic continues that long.
Great, thanks so much. Another question for Joe about dining, and I think this ties on to all of our safety practices. Can you talk a little bit about the safety protocols and procedures that we've put in place for our food service personnel who will be handling the food, packaging food, et cetera?
Yeah, absolutely, Brian. So every one of our personnel went through a thorough COVID training before they had started. We have them, they're taking daily temperature checks, they're filling out a self-attestation form, and anybody exhibiting any symptoms or not able to fill out that attestation form that they are feeling well are not going to be working for that day. As we had mentioned earlier, constant glove changes, safety protocol as far as, cleanliness, which, in all honesty, I mean, this is something we do, right? A lot. I mean, food service, and a lot of different departments are very familiar with always having, the top of the line hygiene practices. So it wasn't a huge change for us as far as the practices go, but as far as the safety measurements for the additional plexiglass barriers, for the additional training on exactly how to do physical distancing, we've staggered some of our in times to make sure that even in the back of the house kitchen areas, our staff are maintaining their social distancing. We've removed the chairs from our dining facilities at this time. We will be, looking for guidance from Dr. Martin and her team on, when we can kind of change our posturing. So this is something that, these plans started very, very early on from everybody on this call, right? From March, we've been preparing for fall and what that's going to look like. We have plans in place, regardless of what risk postures we have, all the way up to a delivery only model if necessary. So we will continue to, utilize the guidance of our healthcare professionals, but we feel confident that we are well positioned to make sure that your student is in a safe environment.
That's great. Thanks so much, Joe. That's about all of the time that we have for this morning. And I would like to thank all of our panelists for their time and for sharing information from their area. For those questions that we did not get to, or for those that were more individualized questions that pertain to your unique situation, I ask that you please reach out to the appropriate service area. And to that end, I would like to take this time to have each of our panelists share the best way to be in touch with their service area to have your question answered. So we'll start with Kathleen, if you can give out the appropriate information.
Yes, I think the best thing to do would be to check out pc.pitt.edu. Also, the coronavirus section on that website is very helpful. If you need anything specifically from me, I'm more than happy to receive your emails, and that is KAK58@pitt.edu. Again, KAK58@pitt.edu. Thanks.
Great, thanks, Kathleen. Joe, the best way to ask dining services questions?
Yeah, so I'm going to start with giving you my direct email, and that's jbeaman, B as in boy, EAMAN, @pc.pitt.edu. Also on the dineoncampus.com/Pitt website, it has a leadership team from Compass, from our food service provider partners, and you can go by specific area if you want to reach out to executive chefs to find out exactly how things are going, or if you want to email Kristen Grover, the registered dietitian, directly. So we look forward to hearing from you. Please don't hesitate to contact us. That's what we're here for.
Great, thanks so much. Stephanie, for questions pertaining to academic affairs?
Yes, questions. If you have an undergraduate question, please reach out to our Vice Provost account, which is VPMCCARTHY@pitt.edu. That's our Vice Provost McCarthy. If you happen to be a graduate student, you can use that account, or you can send it over to our Vice Provost for Graduate Studies, and that account is VPGODLEY@pitt.edu, and we will answer your question or connect you to the right resource.
Great, thanks so much, Stephanie. Brianne, for questions pertaining to new student programs and Welcome Week?
Yes, you can get all Welcome Week questions, new student programs questions answered. An easy email to remember is orientation@pitt.edu. So just email orientation@pitt.edu. If you want to chat on the phone, our phone number is 412-648-2172. Sometimes the answer is quickly answered by the phone. So just give us a call.
Great, thanks, Brianne. Jill, for questions pertaining to campus recreation.
Sure, there's several options. The first one is you can email rec@pitt.edu. And like Brianne, we also welcome phone calls. So 412-648-8210. Our website is rec.pitt.edu. And then lastly, I'll slow down a little bit. My email is jik74@pitt.edu. And any of those will help you. And then even if you just get to our website, there's a lot of links on there that you can get to one of us directly as well. So thanks, Brian.
Great, thanks so much, Jill. Mary, questions regarding student health services and the Wellness Center?
Sure. Please don't hesitate to call us. That's probably the most efficient way to present any questions or concerns you may have. Our number is 412-383-1800. Also, keep a watch on our website. We frequently update it and provide additional information, and that is www.studenthealth@pitt.edu. And then lastly, please don't hesitate to reach out to me. Send me an email with any question you may have. My personal email is M as in Mary, S as in Sam, V as in Victor, the number 8@pitt.edu.
Great, thanks so much, Marion. And Dr. Martin, if there's questions about testing, how should students or parents be in touch?
So the easiest way to reach us is actually to just directly contact the COVID-19 Medical Response Office. And we have an email set up at cmro@pitt.edu. We have that staffed regularly so we can respond as quickly as possible. And for those of you who have sent in questions, and we had a lot of questions after we sent out the first batch of testing dates, we are responding to those. If you have not heard in a timely fashion, please reach out to us again. But we tried to triage the people who had testing yesterday in the testing today to get those answers the quickest. But if you have not heard, please reach out again. If not, please send us questions, anything pertaining from today.
Great. Thanks so much, Dr. Martin. Also, at the conclusion of this session, within the next day, we'll be emailing all attendees with key contact information to be in touch with the service areas as well. Thank you very much for attending, and we look forward to seeing you on campus soon. Safe travels and hail to Pitt.